When people hear the word cancer, the first reaction is usually fear. But what if I told you that a cancer diagnosis doesn't always mean the worst, and that what people think about how it's diagnosed is actually wrong? Today, I'm going to talk about the real facts behind cancer diagnosis, what it actually means, how doctors find it, and why getting checked early can literally save your life. Let's clear the confusion and replace fear with facts. Hello, everyone. Welcome back to Ifechi Health and Wellness. Fact number one that I want us to discuss regarding, because I've talked about myth in my last video. Today, we're talking about facts. Fact number one, it's not just one test. A lot of people think you can take one test and know if you have cancer. That's not true. Cancer diagnosis is a process. It usually starts with a checkup or screening, then moves on to imaging tests like x rays, CT scans, or MRI scans. But the final confirmation comes from a biopsy where doctors take a small piece of tissue to look at under a microscope. That's how they confirm if the cells are cancerous. So, no, a blood test or scan alone cannot give a full diagnosis. It's about putting different results together. Fact number two, early detection can save your life. Here's one fact that everyone should remember: finding cancer early gives you the best chance of beating it. Screening tests like mammograms, pap smears, colonoscopies, prostate exams or investigations, and so on, aren't just a routine, they are life saving tools. When cancer is found early, it's usually easier to treat and less likely to spread. So don't skip your regular health checks, they are more important than you think. Fact number three, not all cancers are the same. The word cancer actually covers more than 200 different diseases. That means every type of cancer, from breast cancer to lung cancer to skin cancer, etc., behaves differently and needs different treatment. Even within one type, there are subtypes that doctors treat in unique ways. That's why they use staging to show how far it spread and grading to show how aggressive it is. The more they know, the better they can fight it. Fact number four, a diagnosis is not a death sentence. Let's be real. Hearing the words, you have cancer, can shake everyone or anyone. But the truth is, a cancer diagnosis doesn't always mean it's over. Thanks to modern treatment like immunotherapy, targeted drugs, chemotherapy, better surgery, and other radiation techniques, many people live long, healthy lives after being diagnosed. Some even go into full remission, meaning no sign of cancer at all. So, yes, there is fear, but there's also hope. Yeah? Fact number five, getting a second opinion is totally okay. If you or someone you love gets a cancer diagnosis, it's okay to ask for a second opinion. Different doctors might look at the same test results and suggest different treatment options, and that's perfectly normal. So, getting another expert's view isn't a lack of trust, it's being smart about your health. Fact number six, mental and emotional health matters as well. Cancer doesn't just affect the body, it hits emotionally too. It's completely normal to feel scared, angry, or confused. That's why emotional support, counseling, or joining a cancer support group can make a huge difference. Taking care of your mind is just as important as taking care of your body during this journey. So, in conclusion, let's recap. Cancer diagnosis takes several steps, not just one test. Early detection can literally save lives. Every cancer is different. A diagnosis is in the end, and you can always get a second opinion. And finally, your emotional health matters too. Remember, knowledge is power. Understanding the facts helps remove the fear and gives you the confidence to take action. Stay informed, stay healthy, and keep spreading awareness because sometimes one shared fact can save life. Thank you so much for listening. Goodbye.